burns are always bad news, but as we age, a simple burn could get complicated. Dr. Ann J. Candelwall is here to help us turn down the heat by reviewing the do's and don'ts for burn avoidance. Dr. Candelwall is the co-director of the Comprehensive Burn Care Center at MetroHealth. Welcome to the show.
Thank you.
So why can burns become so much more serious as you get to be a senior?
So as you age, your skin gets thinner, and therefore a burn that may cause a minor injury in, say, someone who's younger, as you get older, it can actually cause a more serious injury.
Okay, even a splash of hot water, huh?
Even a splash of hot water. You'd be surprised, but water at 156 degrees can actually cause a deep second-degree burn in just 1 second of contact.
Wow, kind of like going outside and getting a sunburn. Now, we know what to do with sunburns, right? We just have to stay out of the sun. We need to put on sunscreen. But you're going to tell us a little bit more about some other kinds of common everyday burns and how to avoid it. So we're starting with scald burns.
Correct. So the first thing to remember with scald burns is that you have to be very careful when you're working around the kitchen. So just be careful, make sure your feet are steady, make sure you're cooking with the proper utensils, and just make sure your hands are dry and you don't avoid and you can avoid spilling anything.
Should you set your water heater at anything specific for that?
And so it's important to set your water heater at a low temperature. So water heaters ideally should be set at 120 degrees Fahrenheit. So anything above that can actually predispose you to a significant burn. So if your house is older, your water heater or the thermostat on your water heater may be set up or set higher, you really do want to turn that down and make sure it's around 120 degrees.
Okay, well that's good. Next that can happen, especially in the kitchen, are grease burns.
Correct. So we all love cooking, and grease burns can actually be very severe. And so a lot of us think that maybe grease burns aren't that bad, but interestingly enough, they actually are. So almost 2/3 of the patients that we see with grease burns in our clinic actually require surgery to take care of their grease burns. They can actually be that severe just because the temperature is very hot.
Okay, how do you put out a grease burn?
So the most important thing is you don't want to throw anything on it. You don't want to throw water on it. You don't want to throw baking soda or anything on it. The most important thing is you just want to cover the pan, so with a lid.
Keep a lid right there handy.
Keep a lid right there handy with you, correct.
All right. Next one I think might even be against the law in some places, but burning trash.
Right, so some people do like to burn trash, and so if you are going to do it, even though you have to make sure that you're within the rules to do it, is you have to be careful. So try not to use accelerants, so gasoline and things like that. If you are going to do it, just make sure that you're staying a safe distance away from the fire. Make sure you have some precautions with you. Make sure you have a fire extinguisher with you, and make sure that you're doing it outside.
All right. Now, one that surprised me is, do people really still smoke around their oxygen tanks?
So you would be surprised, and I know sometimes it sounds funny, but unfortunately we do see a lot of patients who are smoking with their oxygen tanks on. Oxygen is a very, very flammable substance,
Exactly.
And so you don't want to be doing that. Ideally, you don't want to be smoking in general because we all know it's not very good for your health. But if you are going to, please be sure and don't smoke with your oxygen tanks on. You can really get a bad facial burn, and it can really cause some other complications.
Oh man, and make sure you've got your smoke detectors and all of that.
And the most important tool for prevention is to make sure that your smoke detectors are working, make sure your fire alarms are working, and if you do have a carbon monoxide detector in your house, make sure that's working as well. Okay. Prevention is by far the best key.
But if we end up with a burn, now what do we do?
If you end up with a burn, ideally you want to come and see us. So at MetroHealth Medical Center, we are actually the state's only adult and pediatric verified burn center, so we're very unique in that regard. But if you do have a burn injury, you do want to come and see us. For simple burns, sometimes the same treatment that you would for a sunburn, so even a little bit of a moisturizing lotion or a moist antibiotic ointment would be fine. However, if it's a more severe burn...
The ugly-looking blistered burns.
Right, exactly. That's where you especially need to come and see us. So if you have blisters, if it looks like your skin's peeling off, or if you're just concerned, you really do need to come and see us. So seek medical attention, call 911 if you need to, and make an appointment, come and see us.
All right, good advice. The best trick for treating a burn? Preventing it in the first place. Follow Dr. Candelwall's tips for keeping burns at bay. And for more help, use the information that's coming up next.
To learn more, call MetroHealth at 216-778-7800 or visit their website www.metrohealth.org. Next,